of background and why we're here, and then we'll move into some commenting or testimony tips. We will have a chance to begin writing some of that down, and we will have some wonderful speakers sharing their stories, and then we'll wrap up and share next steps of what you can do to take action. Next slide. So one of the big topics we'll mention tonight is energy burden. And energy burden is basically the percentage of your income you pay towards energy bills. And I'm going to go over some of this background pretty quickly, but we'll have an opportunity to discuss questions at the end. So some of the findings I'm going to cover in the next couple of minutes are from this great report that was put out by many of the partners that are on this call. This report was released in 2021 and looked at neighborhoods in Milwaukee by census tract and how much their utility or how much of their income was going towards utilities. Next slide. One of the key findings that I really want to emphasize is this burden on who is paying a large portion of their income towards energy bills is not felt equally. So as you can see here, majority white neighborhoods had about 2.1% average energy burden. That's about the national average, but in majority Black and Hispanic Latinx neighborhoods, those energy burdens were over 5%. Now that's an average. Some of the burdens were above 12%, which is extremely high. 6% is generally considered already a disaster. That's a huge portion of your income going towards energy bills when it could be going towards other things, other opportunities, education, healthcare, etc. So these burdens in Milwaukee are high. Next slide. So if you're someone who likes maps, this shows a little bit of what that looks like in Milwaukee. So on the left, the blue is 0 to 2% energy burden and 2 to 4%, and then red you have higher than 8%. So as you can see, there is quite a bit of overlap when you look at the neighborhoods that are majority Black or majority Hispanic Latinx. It's really not a burden that is felt equally by all. Next slide. So another huge finding from this report is that really overlaps with what we see from historic redlining policies. This is a discriminatory practice that really depressed property values. It led to decades of underinvestment in the housing stock in these areas, limited opportunities for building wealth, and that overlaps with the same neighborhoods that we see high energy burden in today. So this issue that we're dealing with is really a result of a lot of racist policies that we've seen in the past. Next slide, or we're still seeing today, to be honest. So here is a view of energy burden. We know is already a huge factor and is harmful. So that is not being felt by itself. These households are also experiencing higher eviction rates and higher asthma rates. And for those of you that have asthma, you know it's incredibly expensive. It impacts your everyday quality of life. You have lost days of school, lost days of work. So all of these things compound upon each other with housing insecurity, health burdens to really create a stressful way of being. Next slide. So this is just another chart, another way of looking at this from Walnut Way. It kind of reminds me of a spider web. Maybe I'm feeling spooky for Halloween. But you can really see how complicated and interconnected many of these issues. So we talked a little bit about housing insecurity, but food insecurity is another huge one. In fact, many people call this heat or eat because people have to choose whether to heat their homes or to eat healthy foods, and that leads to other health issues. You have thermal discomfort, which can be life-threatening, especially we're seeing more summer deaths as the climate warms, and we have higher heat stresses. We have high pulmonary respiratory cardiovascular diseases. Many of these rates are quite a bit higher for those that experience energy burden. So for example, mental health issues in teens is 5 times higher if you have energy burden over 6%. So some of these rates are pretty significant and really impacts quality of life. Next slide. So this is the true reason why are we here tonight. And right now we have We Energies in a rate case where they're trying to increase rates again. So what I just shared was background and data from 2021, but this problem will be exacerbated even farther. So next slide. What is a rate case? So the way our utilities in Wisconsin work is they are regulated monopolies. So basically you don't have a choice over what utility you have to use in your area. You have one company you can go with. And because they are monopolies in this fashion, we have a governmental body called the Public Service Commission, which has 3 commissioners on it appointed by the governor, that is charged with making sure what your utility is doing is affordable, is reliable, etc. Now, this Public Service Commission is in charge of whether We Energies is able to raise their rates. So right now, We Energies must explain why they're raising the rates and how much money is needed. Then the PSC asks organizations, experts, and the public for input. That is happening right now and is why we're here, because we need to make sure our voices are heard and these problems are being discussed within the case. And then the PSC will decide how much to allow We Energies to increase those rates. The PSC also does a few other dockets, and I just wanted to highlight it on the right here. They did the strategic energy assessment earlier this year, and in that report, they found that Wisconsin's average rates are already the highest among the 8 states in the Midwest, and this is the problem we've had for a while. So that chart is actually from a previous report as well. And we were the highest back then. So this is a problem that's really compounding over time, and yet they're trying to increase rates yet again. Next slide. So this is what We Energies is saying. They claim that they need to increase their rates because they need to build out clean energy projects. However, in reality, we know that they announced plans to keep expensive coal plants running. Those were plants that they said they would retire, and yet they've extended the dates for closure. They also proposed a new gas storage facility. This was despite groups in Wisconsin, such as Sierra Club, showing that energy efficiency programs could actually cost less money than installing a gas storage plant, but still allow for energy to be provided to homes because less energy would be utilized overall, so they wouldn't need to make it to begin with. So they are proposing a more expensive solution of gas that's going to harm health, harm communities, be extractive process, instead of energy efficiency that would help homes. Another key fact that I wanted to point out, which is the reality, is that they refuse to change their profit margins. They have extremely high executive salaries. And We Energies is part of a company whose most recent annual revenue was $8.4 billion. So although they claim this is for clean energy, what we're seeing in the data is that they're putting profit over people. Next slide. So I wanted to share a little bit about what's happened earlier in this case. So we had a hearing in September, and there was many people that were able to share their stories there. Sorry, the screenshot is a little bit blurry, but one thing I wanted to share from this is that many of the testimonies were incredibly powerful. So Melissa Jones shared that, they were notified that they would lose their electricity, be disconnected, and they were on an oxygen tank. They were supposed to get a medical waiver, but they were still threatened with disconnection because those rates are so high. This is an extremely stressful situation, especially as we enter the winter. So lots of compelling testimonies were shared just like that. And then a few weekends ago on October 15th, there was an amazing rally. Some awesome people on this call tonight were part of that and are part of that picture. But we actually had executives from We Energies there. So they heard this, they know that the community is hurting, but yet this week, next slide, they turned around and proposed even higher rates. So despite all this press, despite being at that rally and hearing our voices, hearing how this is harming us, despite hundreds of comments, they're proposing rates, a 13% increase for residential customers. This is almost double what they initially proposed. So the increase would be an average $175 a year for the electric bill. This is paired with a reduction for large industrial customers. So putting kind of families at risk for cheaper prices for larger businesses. And then I wanted to highlight too, the bottom of this article that was in the Journal Sentinel also showed that they're not willing to change their return on equity or the profit they make after expenses. So because this most recent reason they're giving for this rate increase is natural gas prices going up. However, at the same time, they refuse to lower their profits. So we have questions to ask about that, about what their true motives are. Next slide. So right now we have until November 7th to make public comment, and we also have a hearing coming up in person that we can prepare testimony for. So here are some of the asks that we have come up with as a group to make sure our voices are heard. We're asking to reduce that increase, sharing stories about how this is stressful or harmful for your family, making sure that those bills do not go up to that degree. The other big ask is to make sure energy burden stays below 6%. Just to review, 6% is already egregiously high. That's we don't want it that high to begin with, but it should not go above that. So making sure they have programs specifically built for low income ratepayers. So that leads us to the next kind of ask, which is work with us, not against us. Make sure the communities are actually involved in solution building, which has not happened so far. And then the last ask is to invest in communities, not fossil fuels. So that could look like energy efficiency programs or other programs that are aimed at helping people. Next slide. So I just reviewed a lot of information, and I'm sure there might be a few questions. So I want to give the opportunity for people to kind of weigh in, ask questions. All right, I'm not hearing any, so I'm actually going to pass it forward. Michaeli, would you like to cover kind of what testimony can look like?
Yeah, definitely. Thank you for giving that very helpful recap. I feel like it also oriented me again in the whole case, so that was great. So one of the ways that Abby just described for getting involved is to submit a public comment. So the PSC has a portal where you can submit citizens, ratepayers can submit public comments and weigh in as a member of the community. So we wanted to just go over a couple quick tips on how to structure your public comment to really make sure that it achieves your goals. So the first thing you're going to want to do in your comment is to start by introducing yourself. It's important to remember that the PSC is a government agency, and they're dedicated to ensuring that public utilities provide safe, adequate, and reliable service at reasonable rates for ratepayers in Wisconsin. So when you write your comment, you want to introduce yourself as a ratepayer, if you are one, showing then why you have a stake in this issue, that you're a ratepayer, this is going to affect you. When you write your comment, you might also want to share other identifiers to humanize yourself as well, like whether you're a parent or you're an active member of your community or your church or what you even do for work. Whatever it is that feels an important part of who you are, you can start by just orienting yourself and expressing that. And then the main bulk of this is that we want you to connect to the PSC why this case matters to you. If possible, try to make it personal. The PSC right now has plenty of lawyers in front of them making legal and science-based arguments on both sides of the issue. So what they really want to hear from these public comments is not necessarily the same arguments that they are hearing from the lawyers in their briefs, but rather what this proposed increase is going to do for their two customers. That's an important piece of the puzzle. So you might be able to say, you might want to say something like, if this is the case, that you're already struggling to pay your bills month to month, and an 8% increase is really going to start impacting you financially. If you do currently suffer from an energy burden, this is an opportunity to share that. Say that, right now what you need is not a rate increase, but rather affordable energy programs that'll help you meet your needs. You can kind of make your ideological argument there too, like electricity is a necessity and that is not something you can live without. So really make your voice heard in this. It's kind of assuring sometimes to remember that they have to read your comments no matter what they decide. And so really take this as an opportunity to say what you want to say. And then finally, just to make it crystal clear to them where you stand on the issue, make sure you end with your ask. And Abby just went over them briefly, and I'm sure you're going to get some follow-up information covering this. But simply, you're going to want to ask them to reduce the increase, keep energy burdens below 6% in the service area, and to work with ratepayers and not against them. So on the screen, I have a brief example, but I think we're actually going to hear a real life example pretty soon. So I'd love to just pass it over to Maria for that. I can pause though and see if anyone has any questions. Please feel free to jump in. Seeing none, thank you very much. Pass it over.
Maria, you're muted. She's passing it to you. We'd love to hear from you.
Okay, I'm unmuted. So, like, what would you like me to speak about? Like, I know I'd have to, like, what she just said, like, introduce myself and give a personal story. Like, what else do you guys advise besides all that?
So my advice to you, Maria, is whatever you're feeling, just exactly how do you feel about the rates? If it's affecting you, if it's affecting your family, whatever you feel that you want to be heard. So just put yourself in a public comment section, and if whatever comes to mind about how you feel, because we do know that you do have like your story, just tell us your story, tell us how you feel and what it's doing to you.
Is there a time limit?
You.
No, I'm saying, is there a time limit? Is there a limit in
Take your
front of them?
Take your time.
Uh-huh.
Tonight is the night that you're able to say exactly how you feel, and hopefully a lot of folks will see this and this will be very impactful.
Okay. So, I'm gonna do it the way you guys said to do. Sorry. Okay. My name is Maria Beltran. I'm a ratepayer. I'm also a community organizer. I'm sorry, everyone, I'm sick. I'm having asthma problems, so if I trip on my words, please excuse me. But I'm a ratepayer. I'm also a community organizer for Lindsay Heights Engagement. I'm an ambassador of Mighty Small Moments. We're working with out of the Office of Early Childhood Initiatives, and we work with children, very small children from birth to 8 years old, in helping them develop their brain. I'm also on the Coalition of Lead Emergency. I'm part of the Parent Lead group, and we're also working with families that have been poisoned with lead, and that affects their brains. So, and then also a lot of stuff. So what what has impacted me with We Energies and just the utilities is that every year, because I'm part of I was part of the working poor and I still am poor. And I'm on a fixed income taking care of 2 grandchildren, special needs grandchildren. But throughout my lifetime of being a utility customer, it never fails. I've always gotten cut off twice a year. And I have 7 children, 7 grandchildren, and
Right.
and myself, out of my 7 kids, 6 of them are asthmatic, and since maybe 3 weeks of their life, after birth, they've had hospital visits. Due to the fact, because it's usually like the beginning of, well, like into the fall, going into the winter when we're cut off, because we can't have utilities because we have to wait for the moratorium to be lifted, and then we could have utilities. But we've slept in, houses with no gas, no electricity. And then during the summertime, we go throughout the entire summer without lights and gas. And that's when the 2 times of the year my children would be in the hospital. And there I am at Children's Hospital spending a week or 2 just for them to get better from the viral infections that they get from being asthmatic. And it's been a hard life just being a customer of this utility company, that we don't have a choice in being able to go to another company that would work with us, that would be able, like, to give us more leadway in understanding, like, we're poor. And just like there's free clinics or sliding fee scale clinics, that should be an option and available to us. Because, we have elders that get Social Security disability that's less than $1,000 a month. I mean, come on, during the winter, especially in my community of Lindsay Heights, the bill is already, before I remember, it'd probably be like $84 to $90. Now my bill is like 200, close to $300 a month. And being on a fixed income as myself on disability, I have Social Security disability. I am on a fixed income. I can't afford that. Like, and if it wasn't for the pandemic, um, I, I they give us pandemic quests, food share. And if it wasn't for that, like, I'd have to choose between actually feeding my children, my grandchildren that I have custody of, 2 of them, nutritionist meals. And it's hard. It's really, really hard to make ends meet. It's really hard. And my baby is just, when it got cold that week, I didn't turn on the heater, and I feel guilty about it. And they both got really, really sick, burning out with fevers. And then after it didn't break on going into the 3rd day, I said, I have to turn it on. I have to turn this heater on, or they're just gonna stay sick. And so now I turned the heater on at that time, but then it warmed up. But guess who's sick now? Me. Because the cold that they had, the viruses they had, and me trying to fix them and heal them, and now they're better. I'm the one that's sick. So who's good, this is Ricardo. So it's really frustrating. And then now for the rates to be doubled after practically we were yelling at you, but then it seemed like we were begging you to keep our utilities on, to keep programs And then we're saying, we don't make those decisions. It's the state that makes those decisions. Hello, you can enforce it, like, make this more affordable for your people. The only reason you work with state programs is because we're poor and we're going to qualify for it. And when I went to Madison and sat in those metrics, they were doing metrics on how they can still get paid even though we don't pay our bill with these programs, okay, for the poor people like myself. And the guy said, well, how do we get them to apply? Like, forgetting I'm that poor person sitting at the table with you. We're not on the same level. I'm that poor person, and I'm telling you, don't cut us off. Have a sliding scale fee for us people on fixed incomes. Make sure there's a program implemented that you can never be turned off if you have a medical condition, and a lot of people have medical conditions, so that means nobody should ever be turned off, ever. And I use a sleep pap machine because sometimes I stop breathing in the middle of the night. you know if if I didn't have a husband next to me, I'd probably be dead, someone to and then to notice that something was even wrong. I thought, I never snored, but come to find out I snore. And then I go to do the sleep study, and then here I am. I need that done. So we need our nebulizers. We need our CPAP. We need our refrigerators, because being diabetic, you have to cool your insulin, or and then they were born with special needs. Like my grandson has a abnormal pelvic kidney, and it's hard for him to digest sometimes. So he's on his special milk. It's soy, but soy is expensive. And if I don't have a refrigerator to cool that, then he's not getting that milk that he needs, that calcium for his bones. So, and that goes for both of them. And it's scary what they're doing right now with the price hikes and the rate changes. It is scary. Like, it's really, really scary, and it's very, very sad. And I've been living, like I said, since I've been a utility user, every year without lights, just because I can't make ends meet. Like, it's not fair. And just like I told them, you guys have a utility company because we are humans that utilize it. We need it. But if we didn't need your utility, you wouldn't even be in business. So we do need solar energy. And if I could put a windmill in the back of my yard, I would. But just work with us. Lower the rate change. I mean, don't make it more than 6%. I personally think I shouldn't even be paying more than 3% on my income, because I don't have it. I really don't have it. And, that's just a tad bit of what I go through. And like I told Brendan Conway, their PR person, I'm like, the LIFT program doesn't work. It doesn't work. I mean, once you miss a payment, you're cut off and you can't apply for another year or at all. So, I had that program implemented, and then I got kicked off. So then I had to wait to be put back on, and the other one I couldn't. So yeah, that's my part of my testimony. And I hope I didn't take up too much time, Keila.
Well, Maria, I just want to say thank you so much. And I really, truly, honestly felt that, and I seen the faces of some of my colleagues here tonight and their expressions while you were speaking. And I just want to say that That's why we're in this fight together, sister. We're gonna fight for our lights. And thank you once again.
Yep.
Hi, my name is Megan. I'm going to also share an example of a testimony I gave to a recent public hearing for We Energies, but I really want to thank Maria for sharing your experience because that was, I mean, I think we all felt it. And so I think we all appreciate that. I'm going to post a link in the chat. So if it helps people, because I like to write it out. I'm like, kind of a little nervous about public hearings and things, so I always write it out. So if this helps people to read while I talk it over to, I just posted that link in the chat. And so I will share with you now what I had shared at the last public hearing. So I would share my name, I'm Megan, where I'm from, and then I went into this large rate increase We Energies is requesting is to fund their coal plants and new gas infrastructures. And it is clear that rate increases actually disincentivize customers to lower their power usage and its impacts on minorities. People on fixed incomes are disproportionately affected as lower use customers are saddled with more of the cost. And along with this, We Energies is actively working to block customers from installing solar panels, which would reduce the pressure on the energy system and reduce carbon pollution. As a housing case manager, I see the firsthand effects of high energy burden and the financial effects it has. According to the analysis, Energy Burden in Milwaukee, study reveals major disparities and links to redlined areas. The energy burden of households in predominantly Black and Hispanic Latinx neighborhoods is roughly double that of households in predominantly white neighborhoods. And then I say something, just so you guys know, as you have heard tonight from others, so sometimes it's helpful to be like, this is what we've heard, and so I'm reflecting back on that. This is directly negatively affecting the lives of many Wisconsinites, affecting our health and our finances. And I greatly appreciate the individual comments from Walnut Way. So I do that too, to try and be like, you know, we've heard these things from other people at this hearing, and I really want to highlight that I appreciate and agree with what these other people are saying, and that can be helpful. And then I go on to say, we need to decrease racial disparities in energy burden, as well as prioritize carbon reduction goals. This is the time to push for change. We Energies needs to reduce the proposed increase. They need to stop doubling down on fossil fuels and embrace sustainable, affordable, clean energy. We Energies needs to focus on creating a program that targets the households with high energy burden to provide energy efficiency and weatherization programs. This will reduce energy burden, reduce carbon emissions, and save ratepayers money. The Wisconsin Environmental Justice and Infrastructure Initiative is calling on We Energies to do just this, to create a community agreement to focus on solutions that will help the most vulnerable ratepayers, including funding to help energy burdened, low income, and BIPOC ratepayers lower and pay their energy bills. I urge the PSC to focus on this when making decisions on this rate case. Use your platform to tell We Energies they cannot unduly burden customers for their poor decisions to continue operations of these fossil fuels plants. Please deny this rate increase request. So that's an example of what I had shared. And I just want to highlight I always try to kind of say why it's an issue, and then my experience with what I've seen as this issue is. And so that I went in this time into my work experience, but like Maria shared, like I've talked about my family's health issues, or for example, I've lived abroad and seen in Southern Africa and felt that we as US really need to focus on how we make an impact globally and how that affects other countries. So kind of my experience in different areas, and then maybe depending on what the public hearing is about, kind of decide what I think might best fit based on my experiences with the topic. So yeah, so there's an example, and thank you for letting me share that tonight.
I want to say thank you, Megan. We really appreciate you as well. And we're going to continue to move forward. Thanks again, Megan.
Yeah, so I think I'm going to close us out with what we are actually doing next. And so there are two options for ways to make your voice heard, and that's writing a comment and doing a public testimony. The written comment is sort of the option that Mythili showed earlier, where you go to the website and you write something essentially equivalent to the spoken testimony that we just heard today, but putting it through that online platform. Cassie just put in the link in the chat to go to submit that comment online, and you just put the exact same kind of thing that you would have put then done at the spoken testimony and put it there. The deadline is November 7th. So if you're planning on that, just make sure you get it done before then. And you can also send that link around, right? It's not personalized, it's just the general link for the Public Services Commission website. And so if there are other people that you know are interested in this but weren't able to make it today, it's a really easy way to sort of send things around. The other option is to speak at the public hearing that's going to be coming up here in Milwaukee. The hearing that Megan spoke at was a virtual hearing that happened a couple weeks ago. And the in-person hearing will be at the Washington Park Senior Center, and that will be on November 3rd. There will be two separate hearings at 2 p.m. and at 6 p.m. They're the same in terms of your opportunity, it's nice that there are two opportunities depending on what works best with your schedule. Cassie's also dropping in the chat some links to RSVP. Strongly recommend the RSVP so that we can remind you that it's coming up and send you reminder hints for how to write testimony and just sort of help prepare you. We're hoping that it will be a fun event. It's the first in-person hearing that has happened for the Public Services Commission since COVID started. We're open for like snacks and hanging out and having a good time. And if it's anything like the rally was a couple weekends ago, it's going to be an extremely fun time because we're an extremely fun group. I'm gonna be honest with you. So also it would be great to share that link around to folks who have Facebook and try to get some more turnout, because I really hope that it's going to feel like a powerful moment. So those are the two things: writing the comment or speaking at the hearing. You don't need to do both. They are sort of essentially equivalent. So like choose one or the other and tell your friends to choose one or the other. And we can get started on that right now since we've got a couple of minutes. If you're planning on going to one of the hearings, if you could actually just right now click on the Facebook link and register to make sure that it gets on your calendar and that you're thinking about it. And if we're actually going to write, and if you're planning on writing a comment, I would just recommend opening that up now and starting to put stuff in. And for anybody who's starting to work on that, we'd love to hear feedback or questions, or if people want some help with getting started. That's what we're here for. Dog is really loud.
Thank you for sharing these opportunities.
Yes, I think I probably should have said thanks, Victoria. I think we are at about time. Does anybody have the time? It is 7:44. So currently we are open for all Q&As, guys. So if anybody has any questions, all of us lovely folks that are here, I'm sure someone has some feedback and we will give you answers. So Jordan says, will this, let me go in the chat. Just 1 second, Jordan, someone else said something. And if I can get in the chat, okay. Jordan Green says, will this meeting be available as a recording to be shared? Cassie, let's ask you that. Yes, it's a
Yes.
goer.
Yes, it will be. I will send it to you via email if you attended this, or the people who registered but didn't make it tonight. We'll get the recording as well.
Okay. And Annie Steinberg and Eric Hansen said, thanks for all the info and inspiration. They will be making comments. Well, thanks, Annie and Eric. Woo-hoo! We've struck in gold tonight, guys and gals. Yeah, we really appreciate that. At least we've got some folks that are in for it. They're fighting for our lights. We got a couple of comments. I'm not gonna read all the comments, guys, but someone saying it's great seeing you guys and some other things. So like I said, we're still open for Q&A. So if anyone is thinking of something, or if you want to think of something, now is the time, or forever hold your peace. No, don't hold your peace. This is very important information. This is time to talk. Say it loud, say it proud, okay?